Hi guys, thanks for joining. My name is again Allie Ballew. I am a adult gerontology acute care nurse practitioner. Definitely didn't think I was going to be working in aesthetics when I chose that specialty of NP, but here I am and I love it. So happy for it. So like she said, I am a nurse practitioner. I work in Pace, Florida, and I train with Empire Medical Training as well. So we've had Plexr in our practice for a little over a year now, I think, and it gets used multiple times a day, sometimes multiple hand pieces at once, every single day in our practice. It's quickly become my new favorite device and go-to for so many different things. It's like we're always like, oh, Plexr can fix that. So it's been really, really great addition to our practice. And I'm excited to talk to you guys about acne treatments with Plexr today because it really is a big patient population that you can treat with that. You know, you have your teenage population that's struggling with acne, as well as adults that are struggling with maybe some hormonal changes causing acne. Hormone replacement therapy has become a really big thing lately that has caused some adult acne as well. So while it's great for making people feel better, it does kind of cause some new acne to come up, and then also treating any acne scarring from their younger years. So I think acne treatments are a really big part of our practice, and Plexr has definitely become our go-to device to treat it.
Really, acne treatment is sometimes it looks really impossible, with all the technology and everything that we have, all the lasers but still, most of the time you're having problem treating them.
Alrighty, guys. So we are going to do a quick technology overview of Plexr and the hand pieces that it comes with. Then we'll get into talking a little bit about active acne and acne scarring, along with some treatment protocols. We're going to show you some really good before and after results, some from other practices, some directly are my patients that I've uploaded for you guys. And then any questions that you guys put in the Q&A during the session, we will get to those at the end. So this is your Plexr Plus workstation. It is a FDA cleared device that uses a plasma heat energy. So it comes with 3 Wi-Fi hand pieces. I always touch on this because it's really cool that this device doesn't have to have a nitrous tank connected to it, which some plasma devices do. So they're super, super portable. We'll actually go and do like Botox parties. We take our Plexr pens to Botox parties now. So it's super, super portable. We've never had one die, and God knows how long it's been off of the workstation before. So it is super, super reliable and just so portable. Like I said, sometimes we're using all 3 of them at one time. I'll be using one. Our other provider will be using one. Our esthetician uses them for Plexr showers very frequently. So it's really great that we can use, 3 things at one time.
Absolutely. And then one more thing, which is Plexr comes with the smoke evacuator. And then the reason why we have that, because you don't want to breathe what you are sublimating from the skin. So Plexr is basically the only plasma device which comes with the smoke evacuator, and that makes basically your life and your client's life much easier.
All right, so we're going to talk about a pure Plexr plasma generator. So this is the science behind the plasma. So we know there's different states of matter. We have solid, liquid, gas, and then finally we have plasma. So this is a lot different from a laser. Sometimes it's hard for patients to understand the difference between lasers and plasma technology. And I always refer to this slide, lasers start at 300 degrees Celsius, whereas plasma is going to be 20,000 degrees Celsius. So a much higher heat. But with Plexr, since we're not diving deep into the skin, it still has a much lower risk for complications like hyperpigmentations and scarring and things like that.
So for this slide, we use the term sublimation. So sublimation means turning a solid directly to gas. And to make it easier to understand, we have these shapes here. So imagine if you have a log and you're using a laser device, for example, then you're going to end up having a charcoal. It means that the heat energy vaporizes the water inside the tissue. So while the tissue is right there, but it is dried and it is necrotic, basically. So after laser, you have the necrotic tissue and your body has to basically heal and basically remove that necrotic tissue and then generate the brand new tissue. And that takes time. With Plexr, it's sublimation, which means turning the solid to gas. So the log or the tissue is completely gone, and there's nothing for basically left there for the body to remove it first, and then the process will start directly with tissue regeneration, which makes the healing time much faster and shorter. So that's why Plexr heals quickly. The other thing about sublimation is with sublimation, you are removing the tissue. Sometimes people ask us, what's really the difference between Plexr and other technologies, or mainly lasers, that you do one session and it looks like 5 sessions of fractional laser, for example. So the answer is, the reason why we have those results is that you are removing the tissue, and uh, that's why Plexr is very famous as soft surgery. So in surgery, you are removing the tissue. In sublimation, you are also removing the tissue. The difference is you are removing the tissue in basically small spots instead of large scale. And between plasma technologies, so there are few real plasma technologies in the market. So between all of them, Plexr is unique in terms of Plexr is the only one which is not using any sort of other basically energies along with its plasma. You're not using any form of high current electricity or radio frequency to generate plasma. That makes the plasma that we make pure plasma or clean plasma. It means that the energy of uh, Plexr is not mixed with any kind of radio frequency, anything that goes inside the skin and goes deep in the skin. So if you look at this picture at the right side, you see the deep thermal damage and then also deep necrotic tissue, which here we don't have anything like that with plasma. And that makes it basically available for ophthalmology. So we can use Plexr on ocular surface, removing trigium or pinguicula or other stuff. Do you have anything to add, Allie, here?
No, I think you've explained it perfectly. Just seeing that deep dermal dive that lasers, can do in other technologies, just makes this so much safer and less downtime too.
Okay. So when we explain about Plexr being superficial and not causing deep thermal damage, the first question that we get from our basically audience is, okay, then if it is superficial, is it effective in deeper layers of the skin? So one of the cool thing about Plexr is that we have many clinical studies. So different universities, different doctors, different scientists, they wanted to know more about this new technology, so they made basically independent clinical studies. And one of them was done in Germany under confocal microscopy technique, which confocal microscopy technique can basically take pictures from the in vivo tissues. And this is the picture from the eyelid before treatment and after treatment, like 1 month after treatment. So it's not a biopsy or anything, it's the live tissue. And as you see here, before treatment, it looks dark because there's less collagen. So with confocal microscopy, the low power diode laser will be emitted to the tissue, and the reflection of diode laser from collagen fibers and elastin fibers gives you the picture. Now you see in patient number 1, which you have basically black picture, which means less elastin and fibers. And then 1 month after, you see the formation of collagen and elastin all over the tissue. Same thing on patient number 2. The second thing that you see here is the formation of new vascular system, which we call it angiogenesis. When you have angiogenesis, your result will last. And that's why when you treat someone with Plexr, usually the result that you get lasts, it depends, but like for example, for the full face plexoplasty, it lasts between 3 to 5 years. Okay. Allie, here you go.
All right, so now we're going to talk about different types of acne that you guys will commonly see in your practice. And you can see here it ranges from mild to moderate to severe nodular cystic acne. So commonly patients will come to you with typically mild or moderate acne. So here on the left, you can see mild means that you have 20 whiteheads, blackheads, or fewer, and less than 15 of those are inflamed. And so that's a patient that we would use, just a Plexr shower technique. Commonly, a lot of people in our practice are doing this as a monthly membership as well. And so this is a great, sales tactic for you guys to use. We have younger patients and even people in their lower to mid 20s that do struggle with acne, and then coming in and just getting a low downtime Plexr shower monthly will help to keep their acne at bay. And then in the middle, you have moderate acne, which is going to be between 20 and 100 whiteheads or blackheads, 15 to 50 inflamed bumps, and then a total of 30 to 125 lesions. So this is going to be, you can treat these with Plexr shower, but some of these more inflamed areas, you may want to do like a cat resurfacing or even a spot treatment if they already have some type of scarring involved. And then for our severe or nodular cystic acne, this is going to be somebody who has those nodules, that cystic acne. A lot of these patients will have a lot of pain actually with their acne. It's always good to ask to these patients if what they've tried for their acne. It's good to know if they're on any types of medications, especially if they're on some of like Accutane and things like that can make their skin super sensitive and maybe not safe to do some procedures on. And so that's a patient that, you would do a more intense procedure on, like a cat resurfacing for sure.
Yeah, absolutely. And you guys know that for this kind of basically acne people, you can't use any kind of ablative lasers. It's contraindicated. You have to wait until you treat the acne, and then you go for any kind of treatment for the acne scar. The good thing about Plexr is that when you are seeing somebody in this, like for example, look at this one, in this situation, you can treat them in just one session treatment basically covers over 80% of everything. And like I have pictures to show you guys that people like that after one session, like 2 months after one session, their skin is like transformed to someone who had few acne here and there sometimes in the past. So that's, and also the other thing is when you're working in this kind of cystic acne, you are preventing the scarring also. So not only you are treating the acne, you are preventing it from becoming a deep, basic scar at the same time
And when you
without any.
think of, oh, sorry. When you think about two common treatments that people will say for acne, we have so many patients that come in and just ask for like the tried and true, what they've heard of, microneedling. And you can't microneedle over active acne at all because you have the risk of spreading that acne. So with Plexr, it's nice because you're actually hovering above the skin. And so you don't have any risk of spreading that bacteria, which I think is really important because there's a lot of people who come in and they want acne scarring treatment, but they've also got active acne. And for those patients, microneedling is just not something that we can offer them. And so now we have a device that we can treat everything in one session with one device safely without risking spreading it.
Yeah, and also without the need of for any kind of basically medication,
Mm-hmm.
which like
Absolutely.
acne medications are really intense and they can cause lots of side effects. Okay.
Definitely. All right, so over to the left, these are, just more types of acne. So you have the acne conglobata, and this is a very severe type of acne, has inflamed nodules underneath the skin, can infect all areas of the body, and often leaves definite scarring. Like Arash was saying, it's important to treat active acne so it doesn't lead to scarring because inevitably that's what's going to happen, especially with this nodulistic type of acne. This can be precipitated by steroids and testosterone. We talked about hormones playing a really big part in acne. And so for this, we would use like plexoplasty or cat resurfacing. This is obviously a little a little too intense to just use something like Plexr shower.
So especially for this kind of basically acne, which are in the body, like in the back, in the chest, you know that the healing process on your skin, on your face's skin, happens super fast. But in the body, it's so slow. And that's why when you have acne in your body, the rate of scarring is much more than face. So it's more important to treat them with something which can really cure it and also prevents it from causing scars. And also, if you have a scar, you can also treat that with Plexr. Okay.
Yeah, and that has to do with just the vascularity of the face. Your face has so many blood vessels and so much blood flow to it constantly that we don't have to worry about as long of downtimes and healing processes with that. But like you were saying with the body, the further you get away, from your core, the longer it's going to take to heal. And so then we have the acne mechanica. This is caused by heat friction. This is very common where we live in Florida with baseball caps or sports induced acne. The weather's hot, it's humid. And materials rubbing against the skin and preventing, airflow is going to worsen this acne. But it's not that bad. We could treat this with a Plexr shower technique. Could be, done in 45 minutes, and the patient on their way with minimal downtime. I tell my patients, don't do anything to the skin for 4 hours, but aside from that, they can really resume normal activity the next day. And then for our acne prone skin, this is kind of what I was talking about with memberships, those patients that really are just prone to acne. A lot of females too, again, with the hormones, every month they're prone to acne around their menstrual cycle. And so this is something, a Plexr shower is something that you can easily do just to keep that inflammation down and to keep the bacteria cleansed off the skin. Also, a great time to promote, your medical grade skincare that you carry in your office as well. And just doing things to keep their skin cleansed and exfoliated.
Yeah, one of the effect of Plexr on skin is balancing the sebum gland. And because of that, when you use Plexr shower for like even one time, even one time, you really don't need several sessions to see the result. We have treated lots of clients which they were suffering from acne for a long time, and then especially like young ladies, right?
Mm-hmm.
Or boys, doesn't matter. They're suffering from it, and they're like 14 years old, 15 years old. It's too early for things like Accutane, and that's exactly the time that you want to stop it, because otherwise you're gonna end up having acne scars. So 1 or 2 sessions of Plexr shower stabilizes and balances the skin and also the sebum gland. And that's a very good phenomena, because you after you stabilize the skin, you don't have acne that easy afterward. So for like the acne that you might have during the cycles, if you do 1 or 2 sessions, then you actually don't need to repeat that every month. Your skin will be stabilized and will be calmed down. So Plexus shower is really helping a lot in these situations. Okay,
Okay.
so another basically acne types. Go ahead.
All right, so these are comedones. So these are just your basic acne lesions that can turn into bumps called either whiteheads or blackheads, depending on if they are exposed to oxygen or not. And so here you see the blackheads. Like I said, these are the ones that have oxidized to turn black. And they're small, dark colored spots, but they're just clogged pores basically with oil, dead skin cells, bacteria. And then here's a good picture of whiteheads. Same thing, but they are clogged and haven't had any exposure to the open air. And so these are ones that people commonly pick at a lot that can definitely contribute to some acne scarring. Papules, these are when those whiteheads or those comedones become inflamed. This is when they kind of start complaining of pain. They may be a little bit deeper. again, picking and squeezing can make the inflammation worse and lead to scarring. And a large number of these would then categorize that patient as moderate to severe acne. These are patients you definitely want to be treating, as well as with the pustules. These are going to be sometimes even leaky. Like they may even have the pressure to where they open up a little bit on their own and they have that whiter yellow pus in them. Again, high risk for scarring or hyperpigmentation. Post-inflammatory hyperpigmentation can happen just from acne. And so this patient would definitely be at high risk for those things without treatment.
Yeah, they're kind of hopeless of any treatments, but
Mm-hmm.
with Plexr, it's easy to treat.
All right, so nodules. These are going to be very deep in the skin and very, very painful. It says here nodules should be treated by a dermatologist since they can scar. And some of the over-the-counter treatments may not be enough for this patient. For this, you could use like a Plexr plasty to kind of open it up a little bit to try for an extraction, but depending on the size of the nodule too.
Yeah, it's really single session treatment. You do it one session, you hold your Plexr for 2-3 seconds. We will explain it later on, and you will be amazed how easy it is to treat this kind of stuff with Plexr. Sometimes they are like cystic, and you can remove the cyst right there. Yeah, here you go. This is the cystic one.
Yeah, so cystic ones. And, a lot of times with the cysts and the nodules, they used to teach us to get those out. Like you would literally stick like an 18 gauge needle in these things so that you could extract them. And now you don't have to apply that trauma to the skin if you have Plexr plasty available. All right, so diving into kind of like causes of types of acne. So you've got fungal, which is a buildup of yeast in the hair follicles. Those can commonly be very itchy. Hormonal acne, that's affecting, adults who have an overproduction of sebum clogging the pores. As you see in the top left there, cystic acne down to the left, and then that nodular painful acne. Some causes of acne, like we said, acne is a buildup of bacteria, oil, and dead skin cells. Hormone changes are definitely a cause. Stress, environmental factors like humidity, air pollution, sun and headgear, menstrual cycles, and then oil-based skincare products as well. We commonly see young girls specifically using overhydrating products or oily products on their skin that they're getting from, CVS, Ulta, Sephora, and they don't understand that they're actually clogging their pores with those pore skincare products.
Yeah, exactly. There's a reason for something being really cheap,
Exactly.
Yeah, it's not by accident. So in this slide, I wanna emphasize the mechanism of action also. So as you see, there's two slides in acne. So one is basically the bacterial and fungal effect of the presence of bacteria and fungal on the skin, and the second part is the oil and excess activity of the sebum gland. So Plexr works on both of these stuff. It can work on because plasma kills all the germs and bacteria. So while you're working on your skin, you are basically balancing the appearance of bacteria and fungal. You don't eliminate it, but you will balance. You kill a lot of them. So you balance that out, and also you are reducing the activity of sebum glands. So there is less production, and your skin is not that oily basically anymore. That's why after treatments like glass lift or rockstar treatments that are using Plexus shower, we always say you have to use your moisturizer and basically all the time after Plexr, because that makes your skin more dry, and that's why you need more moisturizing. So that effect, when it comes to acne, it's exactly what you want.
Yeah, and just to touch on that a little bit, I know even I was confused before I kind of got into the skincare side of things. A lot of people think, well, my skin's oily, so I don't put moisturizer on it. And so that's some patient education that you need to do there for your clients, because a lot of times your skin starts overproducing oils, which puts you at risk for acne because it doesn't have the moisture that it needs to be supplied. So getting your patients on a good fragrance-free moisturizer that's light, not clogging, low in oil content is so important so that their skin's not overdrive working hard because it's not getting any moisture and just producing oil that's putting them at risk for acne. So this slide is just kind of about some acne prevalence. 80% of males and females from 11 to 30 years old will experience acne vulgaris at some point in their lives. And then 20% of those people, 1 in 5 who experience acne at any time, will end up with some degree of acne scarring. So there's definitely plenty of patients that you can treat out there. And then I thought it was pretty interesting too that 50% of people that are receiving some type of treatment for their acne, whether it's topical or oral medications, they end up stopping it due to either side effects or perceived non-effectiveness of treatments. And we
Yeah.
haven't had anybody that's come and gotten a Plexr and said, I'm not doing that again. They come back and they say, I tell everybody that I come into contact with about Plexr.
Yeah, that's funny because the other reason for that is that when you are treating people with acne, you are also giving them skin rejuvenation and lifting results. So they love it. They love the basic double effect of basically their treatment on the aesthetic side of it and also the medical part.
Exactly.
Causes
Okay.
acne scarring. Um, you want to go ahead?
I think our next slide maybe has some of that, maybe. Yeah. So this causes reducing risk. So reducing the risk of your acne scarring. So for your acne patients who are wondering, how can I prevent that? Like we said, treating immediately, which is one of the points on here, is definitely going to allow for time, and not allow for time for scar tissue buildup. So you want to treat the acne immediately. Even if I have some girls who come in, it's hormonal acne and they just have a little spot on their jawline and they just want to come in for a quick spot treatment. And they can come in, we'll do a quick Plexr treatment on them. They're in and out in 20 minutes. So other ways to reduce the risk is obviously medical grade skincare, like we said, a non-oil based moisturizer, use of sunscreen. That's going to help preventing hyperpigmentation around the acne scarring, no picking, squeezing, or scratching. And then also smoking always increases your risk for scarring and poor healing.
Exactly. Also, just one point here. There are some oil-based moisturizers that they are not comedogenic, so you can use those basically products.
Alrighty, so this slide over here, this video is showing you guys a Plexr shower treatment. You can see the patient super comfortable. It doesn't require numbing for Plexr shower, and it's just a light resurfacing. It actually removes like little tiny micro pieces of skin, not that you can see, but that's what's causing that tightening there. The high temperatures obviously kill the bacteria and any active acne, while also, like you said, they're getting skin tightening as well. That's why they love it so much, is they're not just treating acne, they're doing multiple things with one treatment. All right, so.
You go ahead.
Oh, you're good.
Okay, so this is basically what happens under microscope. So when you're moving your hand along the skin, you are generating nanoplasma balls, and these nanoplasma balls, they basically remove your skin in a microscopic scale. So that's the source of the smelling when you smell. Now, when you're using Plexr shower, of course, the speed is important. You don't want to go too fast. You don't want to go too slow. Like this is too slow and it's going to be too fast. You want to go like something, this is too fast, basically. You want to go something like this. Allie, go ahead.
And then it's good to just go ahead. I mean, this is more for Plexr shower, but also if you're treating, a generalized acne as well, you want to spend about 3 minutes in each of these 5 areas on the face. And that just kind of gives you a good, visual so you can divide the face up and make sure you're spending an appropriate amount of time on each section. And then after you're doing your Plexr shower treatment, after you finished all the time zones, then you're going to make sure, really important, is to give the proper actives and boosters immediately following the treatment. And just like how you tell your patients with like microneedling, just like with Plexr, these channels are going to be open for 4 hours. And so for 4 hours, you don't want to put anything on your skin other than I put some on immediately after them, the actives, like an Acto Firm or an Acto Reverse serum. And then I send them home with a little micro vial of it as well. And I tell them for the next 4 hours, I don't want you putting anything on your face other than what I'm handing you right now.
Yeah, that's exactly what to do. The other thing is for acne treatment, we also have other products like the salicylic acid,
Mm-hmm.
uh, which is the perfect solution for acne. And after Plexus shower, when you apply that, it also penetrates deeper in the skin and it works much better. Just a disclaimer here, if you want to use any products other than our products after Plexus shower, you need to be mindful because not every product is designed to penetrate. So most of the skincare products are designed to stay on top of the skin. So our product is designed for this purpose, so they're safe for it.
Okay, and then for scar evasion with spots plexroplasty, you're going to use the Plexr Plen with the ablative tip. And so then, like Arash said, you're going to be using, anywhere from 1 to 3 seconds of the energy on the skin. And you're going to want to do this at the peaks or the edges of the acne scar apexes. That's going to actually sublimate the tissue on the outer edges of the scar, helping to pull taut and lift any pitted tissue from like an ice pick scarring or boxcar scarring, to help and pull that skin taut and help it to lay more flat again.
Yeah. So this is not acne scar, but this is basically how Plexer works. So you're not touching the skin while you're using Plexer and you're making it like triangles and you feel the whole area. Now for the type of acne, again, acne scars, again, we have different type of acne scars. So ice pick is one of them. And as you see, we have very sharp edges. So the way that we treat them, we focus on the edge first, and then on the surrounding area. And that's going to be the result. So you lower the edge, and at the end, you work on this area using your, I mean, using your basically CAD resurfacing technique or inside the acne. So you use plexoplasty on the edge, but not inside the acne, but you use plexoplasty inside the acne. So the the CAD resurfacing inside the acne. So the CAD resurfacing does not remove, so it doesn't make it deeper, but it activates the collagen production. The second one is the rolling acne, very popular, and we have some other examples here too. So for these kind of acne, instead of working inside the acne scar, you work in the area, the normal skin in between acne scars. So you lower the basically normal skin and also you lower the edge. So as you see in this one, the scar is much less, and then you work on inside the acne with your CAD resurfacing technique. So you also raise the base by creating more collagen down the line. Usually these kind of treatments, they need about 1 to 3 sessions. So the box scar, it's kind of like a hypertrophic acne scar. So in these cases, you just remove the hypertrophic part and then the results are very quick. Now, hyperpigmentation acne scars, they are also very popular and it's like a dead end. You don't know what to do with this kind of skins. They're very sensitive. You can't use any kind of basically energy-based device to help them. It's very difficult to treat. With Plexr, easy. Again, you can go all over the pigmentation area using your white handpiece, making using the Plexr plastic technique. Now you can use the line technique or you can use the spot technique. Both works. So here I have some examples, like the real examples, and I'm going to show you how to treat them. So as you see here, there are some treatments here. Let me play my slide at this point. Let's do that. Okay. Okay. So imagine you are treating this acne. So you want to work on the edge, not inside the acne. So you put your triangles just like that. Do not enter. And then the other part, just like this one. And then here you have another edge. So with one spot, you are basically working on the edge, and then when you make it triangle, you are kind of extracting it, pulling it this way. And here, as you see, you have one edge here, 1, 2, 3, and that's why it's good to do that under a magnifier. So you want to see what's going on, and then you work based on what you see, and you design your patterns, and that's what makes Plexr different from, for example, fractional laser or anything like that, because with laser you are designing your treatment for each acne. Let's find another example. Look at this one. It's a beautiful scar here, and that's how you work on it. So after you're done with the scar, that's the pattern that you have. So not everywhere in the skin is treated. You kind of, or here, if you look at this area, this is one scar here, another scar here, and another scar here. So here you have the normal skin. You see that? You have the normal skin all around this area, and also there's normal skin here. So the way that we treat this is, let's start with here. You have the border. Then this border. Here. And then here, between these two scars, you make a zigzag pattern, because you have a little bit of space here. Here I make a dice. And then here again. So as you see here, that's how it looks after. So we put our dots around the scar. Another example. Again here, that's where you place your spots. This is the Plexr plastic technique. So look at here. There's a one edge here, and I'm putting my spot right there. So it's very important to really focus in these details. So this is the art. This is your art, basically. It's not a blind treatment. And then on top of it, when you're done with this, then you do cat resurfacing all over the area. And then you do cat resurfacing everywhere. You make your hashtags. This is another type of acne scar, which is hyperpigmented. So, and then as you see here, we have somebody with a skin type 5 or 4. So you need to be careful. Usually you don't use any kind of laser for this kind of skin. The treatment is gonna be just CAD resurfacing for the first session. And usually with 2 or 3 sessions, the skin is totally transformed with no scarring, no pigmentation. You can also remove this mole if she doesn't like it, at the same time. This is another example of the same thing that I showed you, and that's going to be the pattern. So these yellow areas are the areas that basically we are not treating. This is the scar, and then you treat the neighborhood. So if you have a cystic acne or you have acne with infection, you can also hold your needle on top of it for like 2 seconds. You open this and then you squeeze it. You take all the infection basically out, and basically that's it. It will be gone in few days. Allie, anything to add?
No, I don't think so. I would, like you said, you can extract with the Plexr shower, and then you could even do like a light like a Plexr shower over it too.
Yeah. So this is also very popular, these are like Allie talked about it. These are like ingrown hair, and these are not acne, but the treatment is very similar. You can use plexus shower technique, or you can use CAD resurfacing technique if you want to do it in one session. Very simple.
Those are kind of like enlarged pores too, and you're going to get some pore
Yeah,
tightening with Plexr as well, which is going to further prevent, future acne and future blackheads and things like that.
exactly. So this is again the plexoplasty for the back. We talked about that before. This is something which is also very popular sometimes, and if you don't treat them early, then it will end up big cysts or big infections, the ingrown hair. So for the ingrown hair, you treat the ingrown hair just like the acne. You hold your needle on top of the area, and then you open this, and it's done in one session. These are some results. These are your clients, right? Your patients.
Yes, these are my patients. This was one session. She just came in. This client has never had acne in her life. She's always had like flawless skin. She texted me panicking. She was about to go see her boyfriend in a different city. And she's like, I've got to do something, but I don't have any downtime. And I was like, you're fine. Just come on in. We did one Plexr shower on her, and that was her, I think the next day. Either the next day or the day after.
Yeah, it
Um,
says 2 days apart.
two
Amazing.
days. Okay. And this was one of our lovely models. She's very young. I believe she's 15 years old. And this is one treatment. And these pictures are taken 2 months apart. So I did do an additional treatment on her that day that she came in, where you see her after photos. She has a little bit of texture and like a little bit of like under the skin stuff. But you can see her redness has significantly gone down. Nothing that's super inflamed at all. It's really just like a little bit of minor texture at this point, and that's from one Plexr shower treatment with very minimal downtime. I think we did do a little higher energy over some of the active areas, just to kill off that bacteria, and she looks great now.
Yeah, she looks happier actually.
Yeah, she does.
I
She is
remember I
very
was there
happy.
for the first
So is her
session.
mom. And then this is one of my patients. You can see the lighting's not super great on the first one, but she did have a pretty deep acne scar there. She's one of my patients that's been coming in monthly and telling me that she's telling all of her friends about this treatment. And so I did do some scar treatment, so some plexor plasty spots right around that deep scar that I have circled there. She had a couple little scars right there, and the rest of it we just treated with Plexr shower for a lower downtime. So we did this is after 3 treatments. but the plexroplasty one, I actually only did that her first treatment. And then after that, we've just been doing Plexr showers, and she had a really great response just from one treatment with the ablative tip. All right, so aftercare. So like I said, you're gonna apply topically either Active Firm or Active Feel serum or an Acne medical grade serum, a salicylic acid immediately following the procedure. Like I said, those channels are going to be open for 4 hours, so they can go home with some additional serums or actives to put on during that window. I usually do, like for face, a total of 1.5 cc's. And then that evening, they are able to use a gentle cleanser. You don't want them using like any retinols or exfoliating anything in the areas until they're healed. Especially, this is specifically for like the ablative treatments, like around the acne scarring too. That skin's going to be obviously a lot more fresh and sensitive. And then just avoiding, again, this is more for ablative Plexr shower parts, is not as intensive aftercare. But with doing any like type of ablative or scar revisions, you want to make sure and for sure tell them to avoid any sun exposure. Any saunas, self tanners to the area can be harmful while healing, and just keeping the area clean, dry. And they can usually apply their regular products as soon as they're healed.
Okay,
this is
so
oh yeah, you talk about this. This is your
go ahead
stuff.
and I will take it.
Oh, sorry. What did you say, Arash?
I said, go ahead and then I will add.
Oh, okay. This is the
Because I know
Active
you
Feel.
love Active Feel
I
products, so I
do.
will.
You know we go through it. We're constantly ordering it. You know how much we use it. So we really love the Active Feel line. It's Skin and Tonic. So we use the Active Firm and the Active Reverse. I think the Active Firm is super, super great for just like general, skin tightening. Can also help a lot with the texture that you get from, some acne scarring, those rolling scars. Active Reverse is a little more of an intense active that you can use afterwards. And I believe that one also targets pigment. And so that's good, if the patients have some hyperpigmentation or PIH following acne scarring specifically, but just in general, we love these products. They're super safe. They're made to use right after Plexr. And like I said, usually about 1.5 cc's. I think you can treat about 3 patients per vial of the serums.
Yeah. So the cool thing about Active Feel basically product line is they are CD44 receptor activator. And what does it mean? It means that you are kind of mimicking the aging. So you are sending a signal to your fibroblast receptors, and then that signal is equal to the signal of aging. So your fibroblast feels the aging is happening around it, and it will start producing more collagen and elastin. And as you said, it has 2 types, Active Firm and Active Reverse. Now, we also have Active Bar. So Active Bar is the 6 main ingredients that you need for most of your skincare treatments. For example, for acne, we have salicylic acid and acetylniacinamide. For lifting, we have mandelic acid and glycolic acid. For pigmentation, we have alpha-arbutin and tranexamic acid. So let's say you are treating a hyperpigmented acne. So after your Plexr shower, you apply your alpha-arbutin first because the pigmentation is the deeper, basically, layer of the skin. And then you can apply salicylic acid on top of it. So there are some kind of mix and match and designing personalized protocol for each person if you're going to use your Active Bar. That's another part of basically Plexr. So the result that we showed you, they're not with Active Bar, they're just Plexr by itself. Okay.
And then
So
recovery time, like I said, for Plexr shower, it's very, very minimal. I mean, they may have a little bit of pinkness, a little bit of redness if you use any higher energies around there, but that's going to be 4 to 12 hours of for Plexr shower. And then if you use sublimation, for acne scarring. Sometimes that can take 5 to 7 days to completely heal. It'll kind of just be like a little brown dot scab, like you saw on the patient whenever they were actually doing the sublimation on the patient, when you saw like her under eye area that was, for example, of technique. You may have those little brown spots for a little bit, but those will flake off and the recovery is super easy.
Right. Okay. So there's a few slides here that we want to be mindful of what we are removing. So I know that acne is very different from any other thing, but if the acne is pigmented and it's a large one, you might basically misdiagnose it with anything which is close to skin cancer. So before you start using before you treating basically any kind of skin concern, you want to know the differentiation between those with melanoma, with SCC, with BCC, and all of that. So I like to add these slides to most of our webinars. It's the education that we all need to remind ourselves. So like, for example, melanoma is very popular, and there are 4 or 5 criteria that differentiates melanoma from anything else. The asymmetry of it, the border, which is not regular, the color, which is not monocolor, it has different shades of brown, the diameter, and also it's evolving and changing. So you can treat birthmark, mole, acne, papilloma, anything, but not melanoma. And as you guys know, everything that we do is based on a clinical study. We have over 30 clinical studies now on Plexr, and you can access that through this QR code. They are available to download for free, and lots of good information actually there. Okay, let's go to the Q&A.
Well, John has been very on top of these questions today. As soon as they come in there, John has had them all answered.
Yes, okay.
Oh, we just
You
got
can
one.
take a look through if you'd like to see if there's anything you'd like to add to or change. But I feel like we addressed most of the initial questions here.
We do have a question that just popped up. My rep tells me that alpha arbutin is no longer available. What is taking its place?
So it is available in the other form. We have a serum which is H1. H1 is the combination of alpha-arbutin and tranexamic acid. It also has microencapsulated retinol, which is very gentle. It does not cause any skin burning or anything. The retinol is not active. It will be activated when it enters basically the skin. And they can use it instead of the last version of alpha-arbutin that we had. What's the difference between Plexr, shower, and CAD resurfacing? So Plexr overall has 3 different levels of treatments. We have the ablative, which we call it plexroplasty. We have the semi-ablative, which we call it CAD resurfacing. And then we have the nano-ablative, which is Plexr shower. All these 3 modalities, they are ablating the tissue in different scales. So the CAD resurfacing, which we use it like a line, is removing like a medium size compared to the ablative and the Plexr shower. It is equal to fractional lasers when you use CAD resurfacing. The difference is with CAD resurfacing, you can treat all skin type, and usually 1 session of CAD resurfacing is equal to 3 to 5 sessions of basically fractional lasers. So I'm assuming that CAD resurfacing is done at a separate treatment after borders. No, we use it in the same session. So with CAD resurfacing, this technique has different purposes. One of the purposes is to basically create the lifting and shrinkage in the skin. So when you have that effect, you're also opening the whole skin, and your acne scars, they show less, and they are basically treating from the other side. One of the good good cause, one of the good basically ways of treating the acne scar is that when you treat the whole skin, not just the scars themselves. Because if you just focus on the scar, you're not creating that lifting and that contraction that needs to open the scar. With CAD resurfacing, we treat the whole area, and that helps for that purpose. What about people that are allergic to salicylic acid? If somebody is allergic, you don't use them. Sure. Actofil is available in Canada. Yes, we have a distributor in Canada.
The 1.5 cc's is included in what I send home with them as well. That's a total for immediately after and what they get sent home with.
Yeah. And then, yes, for CAD resurfacing, you can use the numbing cream unless you're using CAD resurfacing for the scalp, because CAD resurfacing helps a lot for hair growth. And that is something that we can talk about it in another webinar. But for the hair growth and hair stimulation, using CAD resurfacing is not causing any pain. So people can handle without numbing. Also, for the body parts, sometimes you can use CAD resurfacing without the need for the numbing. But for the face, we recommend to use basically the numbing cream.
Someone asked if applying exosomes after a Plexr shower helps with acne. We usually just use exosomes to enhance healing. So that's just to quicken the healing portion. Like after an ablative, it may be more appropriate to use exosomes versus just like a Plexr shower or treating acne specifically. You're probably going to have better results with the salicylic acid versus the exosomes, which are great for healing.
Yeah, correct. And also, another question is about the dark circles. So the answer is, the question is Plexr shower helping for dark circle? We actually have protocols for that. So you can use Plexr shower for dark circles. It's really effective, and you can see the result from the first session. And then usually they need about 2 to 3 sessions to complete the treatment. Plexr shower is like a key to most of the treatments that you want to do. And also, the other good thing about Plexr shower is that it prepares the skin for more aggressive treatments. Most of the time, I mean, every day, the more we are using the Plexr shower, we believe that we need less of more aggressive treatments. I was talking to Dr. Crowley, and he was talking about some of the result that he got from the eyelid lifting just with Plexr shower, which is like unbelievable, you know. At the beginning, when I was talking about Plexr shower like 2 years back, everybody was like, it's not that aggressive to give the result, but come on, we are stepping into the future of aesthetic, means less aggressive and getting better result without being aggressive. And Plexr shower is basically in the forefront of that movement.